Hello and welcome to the RPTH Research Recaps, where we dive in a little deeper into the science being published in RPTH. My name is Dr. Mandy Lau. I'm an internist hematologist at the Erasmus University Medical Center in Rotterdam, the Netherlands, with a special focus in clinical and research practice on thrombosis and hemostasis. I'm also an editorial board member of the RPTH. I'm very pleased to introduce Dr. Angela Wyand. Dr. Angela Wyand is a pediatric hematologist at the University of Michigan Medical School, with also a focus on hemostasis and thrombosis. She has a particular interest in the care of young women and girls with bleeding and clotting disorders, as well as on Willebrand disease. She uses social media, specifically Twitter, where she's better known as the Shematologist, for medical education and advocacy, which led to the manuscript discussed today, titled Sexism in the Management of Bleeding Disorders, co-authored with Dr. Paula James from Canada. This paper has received a lot of attention on our Twitter feed, which may be a testament to how important this subject is. Dr. Wyand, we look forward to hearing your presentation.
Thank you so much. Just going to share my screen. So I'm excited to be here and talk about this manuscript. So it is kind of a fun story how this came to be. So as Dr. Lau mentioned in my introduction, I use Twitter for medical education in the form of tweetorials, which are basically just a string of tweets that are linked together on different topics. And I started doing this about a year ago and have started to get a lot of requests from people for specific topics to do. And so back in the fall of 2020, I was wanting to raise some money, and so decided to have a little contest for who could pick the next tutorial topic. And Dr. James donated and was one of the winners. And her topic choice was sexism in bleeding disorders, which I thought was a great topic because I'm very passionate about this area, and actually having done the research for this article and for this tutorial, actually learned a lot myself. So, I think in general, there's kind of a cycle that happens. I think that menstruation in general, for as long as there has been recorded history, has been stigmatized and not talked about. And so as such, I think a lot of patients don't know what a normal period is. And then I think a lot of providers don't necessarily know what a normal period is. I think this is compounded by the fact that we have inherited disorders. So I see a lot of young women who come in with really heavy periods that they describe as fine or normal. And then when you delve in deeper, they have very abnormal bleeding, but their mothers also had abnormal bleeding. And so that has kind of been normalized within their family. I think this leads to bleeding disorders being under-recognized and underdiagnosed. And I think there's also a component of a lot of the resources within the bleeding disorders community has been dedicated to men and diseases that historically have been thought to only affect men, such as hemophilia. So this dates back, going a long time, just looking at hemophilia. I'm not sure exactly how you pronounce his name, but Nassi, or maybe, was the first to describe the genetic basis of hemophilia, and described it as being transmitted entirely by unaffected females to their sons. And this was further this kind of idea of these women that, were just completely unaffected, but these men being victims of it by an article in the Lancet in 1886. And I think this narrative is really harmful to women, and I think has been perpetuated. When you think about it, every woman who is born to a man with hemophilia, 100% of those women carry the abnormal gene versus 50% of men who are sons of carriers. But I think there's really this narrative of females just passing this along to these poor men who are victim to it. So in 1923 was actually the first published report that I could find of a woman who was diagnosed with hemophilia. And this case really brought to light, I think, how much people, thought of women with hemophilia much differently as they do today. So this was a woman who was diagnosed actually in middle age, but she had been found when she was 10, unconscious on the floor after she'd had a tooth extraction, and ended up having to be hospitalized for 3 weeks following that. She also had a lot of history of other hemorrhagic episodes and things that, at least to me as a pediatric hematologist, would definitely raise red flags. But unfortunately, she was not diagnosed until middle age. And even in reporting this, again, reporting someone who had a syncopal episode due to blood loss after a tooth extraction, even the authors noted that this was pretty atypical and kind of minor compared with men with hemophilia. Of note, there was not another published report for another 25 years. So I think that we've made some progress. There have been little steps in the right direction, and I think a lot of interest and movement in this area. But I think one of the first things that really was some signal of progress was when the World Federation of Hemophilia updated their definitions in 2012 and did state that hemophilia could occur in men and women. In 2018, the ISTH also came out with details about what would constitute a diagnosis of hemophilia and included female carriers as long as they had levels less than 40%. But to this day, the Center for Disease Control and Prevention in the United States, their website still says that a female who is a carrier sometimes can have symptoms of hemophilia. In fact, some doctors describe these women as having mild hemophilia. So clearly we haven't made as much progress as one would hope. So I think there's, in general, especially for hemophilia and women who are affected by hemophilia, a lot of under-recognition and under-diagnosis, as it's an X-linked disease. I think historically it's taught in medical education that only men can be affected, although we know there are multiple ways that women can also be affected. When you do the math about how many people in registries should be men versus women, it's estimated that about 30% of hemophilia registries really should be made up of female patients. But the most recent report from the WFH, that number was around 1.5%. There's also significant delay in diagnosis when women are delayed. So in women with severe hemophilia, they have a delay in diagnosis of 6.5 months compared to their male counterparts, despite having similar symptoms and similar age at first bleeding. This is similarly even more prolonged for patients with moderate hemophilia at 39 months. And I think mild hemophilia, although I haven't seen literature on that, is probably even greater. So this doesn't only apply to hemophilia. I think von Willebrand disease is another example of how sexism in medicine is perpetuated. So if you look at the statistics in the United States, half of women with von Willebrand disease are not diagnosed by 12 years of age. And if you compare this, 76% of men are diagnosed by the age of 10. For women in general, there's thought to be about a 16-year delay between symptoms and diagnosis. And by the time they're diagnosed, most women have up to 6 symptoms by that point. Even looking at the kind of resources that are devoted to diseases. So hemophilia is a much more rare disease than von Willebrand disease, which we know is the most common inherited bleeding disorder. But if you look at the resources that are actually devoted to diseases, it's incredibly discrepant and does not reflect the underlying epidemiology. So this is just a figure illustrating how many patients are affected with von Willebrand disease compared to hemophilia, with the red figures illustrating more severe disease. And although it's more common for hemophilia to be severe, the absolute number of patients with severe disease is likely not all that different. So then when you look at the actual kind of resources and support that are in place for von Willebrand disease compared to hemophilia A or hemophilia B, it's really striking to see. So this is just kind of an overview of open and completed clinical trials through clinicaltrials.gov. And as you can see, although von Willebrand disease is much more common, there are many fewer trials that are both open and completed that are available for these patients. Additionally, when you look at publications that are indexed in PubMed, the number that are indexed for von Willebrand disease is much, much fewer than that seen with hemophilia A, and is above hemophilia B, but still does not really reflect the underlying epidemiology or number of patients affected. Additionally, I think this translates to pharmaceutical companies and the way drugs are developed. And as you can see, this is just a figure outlining the number of currently approved products for the various diseases. And as you can see, we do have plasma-derived factors for von Willebrand's disease, but recombinant factors have lagged way behind that, which is seen with hemophilia A and hemophilia B. But hopefully this will change in the future. And then I think, a lot of this is perpetuated by that stigma that's associated with menstruation. So this is Pliny the Elder, who was in ancient Rome, I believe, and is just one example of kind of the stigma and taboo that surrounds menstruation, where for centuries people have kind of attributed various things to the act of menstruating, or to women when they are menstruating, a lot of them being very negative, but none of them really being things that would make it more likely for people to talk about periods, or more likely to feel that that was a appropriate thing to discuss. And sadly, I think that really continues in society. So there was a big kind of survey of people between about 13 and 50 back in 2017. And it really showed that most people really feel that periods aren't something they'd like to discuss. They'd rather be bullied than discuss periods. About half of people felt that there really was stigma attached to periods. And one of the things that was most striking to me was that when they looked at parents, specifically of daughters, over 40% of them had never discussed menstruation with their daughters. So these are clearly individuals that are going to menstruate, and the fact that that's never kind of discussed or even talked about, that like, yes, you will bleed, but you shouldn't bleed more than X, Y, Z amount, is never really relayed to these young girls. And so I don't think it's surprising when you see studies that show that 40% of women with heavy menstrual bleeding, 40% of women with menstrual bleeding seek care for that menstrual bleeding, with a lot of them not choosing to kind of get help, and whether that is because they don't recognize it as abnormal themselves or don't feel comfortable. And additionally, when you look at even providers, at least one study has shown that in pediatrics and family medicine, there's not very many providers or clinicians that are really documenting a full menstrual history. I think that's always a difficult thing to discuss. And I think looking at documentation versus what is discussed is also hard, but I think clearly we still have a lot of room for improvement in this area. So lastly, I just wanted to kind of talk about, I do think that there is progress being made, and I think that there is some momentum in this area. These are just a few of the organizations that I think are really trying to further research and discussion and advocacy in these areas. There's the Foundation for Women and Girls with Blood Disorders, and they have funding mechanisms in place for research. They have an annual meeting of a Learning Action Network. And then they also have started having a larger meeting as well. Let's Talk Period is a website that you can go to. It's letstalkperiod.ca. Dr. James has made that, and it's a great website where girls can go and take a self-bleeding assessment tool and see if their bleeding is abnormal and get resources on who they should talk to about that. I think a lot of people are making things like the Women Bleed Too toolkit, which basically is just a collection of resources. And I think this is just kind of in North America, but I think there are also a lot of exciting things being done worldwide. I know in Europe, there was just some documents put out about kind of priorities for looking at women with bleeding and clotting disorders. And the National Hemophilia Foundation also is just started a working group on this issue as well. So hopefully that momentum will continue, and we can continue to improve the care of these young women and girls.
Thank you, Dr. Wyan, for that great presentation. I have a couple of questions for you. One of the quotes in your article that really struck me was the name of women with hemophilia. Mostly they're called carriers, and that's also been a problem, as you mentioned in your introduction, historically, that the carrier label doesn't do justice to the bleeding problems that they can have. And one of the sentences that you use is the carrier label is dismissive and invalidates their symptoms and experience. But there's been some discussion, obviously, as you also indicated, with the WFH and the ICH and the recent CDC, how to call these women. What would be your suggestion? Should we just call them women with hemophilia, which historically may be difficult because women weren't supposed to have hemophilia? Or is carriers enough as long as we increase awareness? What would you suggest?
I think it is difficult. I think that unfortunately, there is a lot of data. Michelle Stolzberg, I think, was the one who had published that article that showed how kind of dismissed women felt and how they felt kind of cast aside. I think the difficulty with carrier is that, with any other disease, if you hear carrier, it's typically thought that you're passing along the disease but not affected by it. So I think that's a kind of a big hurdle to get over if you do use that term. So I think it probably makes sense just to call them, a person with hemophilia. But I do think it's difficult because it goes so deep in terms of the education of, medical students or even before then about hemophilia. I meet women who, have gone to the ER and told the ER physician that they have hemophilia and have been laughed at and said, oh, you must not understand. It must be a different bleeding disorder. And so I think it's a huge hurdle, but I do think that, especially if their factor levels are abnormal, I think, classifying them in the same way as men with similar factor levels makes the most sense to me.
Oh, I agree with you. I think hemophilia it's still difficult because I've just had a female patient that said she had hemophilia and was just cast aside because she couldn't have it. But I think together with that, that we should consistently name them women with hemophilia, plus the education about it is essential. I also thought about in your article, you mentioned that the age of bleeding disorder diagnosis is much older in women than in men. So the average age in women is 12 or older, and in boys, it's much younger. I was wondering whether you think that has anything to do with how the ICH bleeding assessment tool is currently set up. Because one of the elements that you can score points with as a woman is menstrual bleeding. And most women do not bleed until they're about 12 years of age. And maybe they're less, as children, they're more careful, so they may have less trauma than boys. Is there another way you think we should improve the bleeding assessment tool because of this issue that menstrual bleeding is only calculated at older age?
Yeah, I think it's a really hard question. Being a pediatrician, I think we deal with this all the time where, I remember having a patient come in who was 3 or 4 and they had one bruise that was on their chest, which is a weird place to get a bruise. But I was like, that was the only thing they'd ever had their whole life because they were 3 or 4 and their von Willebrand factors were like horrible, like undetectable. And I was like, this is so odd, because part of me had thought, like, you have one bruise, like, the family was like, they don't bruise any other time, like nothing at all. And I think, unfortunately, I think it's difficult when people are young for that reason. I think there is okay, are girls like less active or less, likely to be rough and tumble when they're younger. But I think on the flip side of that, you could say, but boys, maybe more like their bruising would be more dismissed because they're so active or whatnot. I think what's more disturbing to me is that like the kind of gap between symptoms and the diagnosis. Because I think, if you have somebody diagnosed when they're 12 with von Willebrand disease, but they've never had a problem before that, then I think, I don't know that you can say that it was an issue that they weren't diagnosed till they're 12 because, they never had any problem. It's ideal if they can be diagnosed before periods, because then you can do some counseling and hopefully avoid really bad periods. But I think if there's no symptoms before then, I'm not sure there's a lot we can do. But it's a great question. And I think bleeding assessment tools can be so helpful, but like realizing the limitations of them is really important because they're clearly not always perfect.
And I guess with women who have fathered to have hemophilia, it all comes down to education again, that they are carriers by nature, so that you counsel them perhaps before they start menstruating. So we need global advocates actually for this issue probably.
Yeah, yeah.
And more of a other difficult question is, do you think it would help, because we're mostly women talking about women's issues? I mean, you and Dr. James are very much about bleeding disorders. Saskia Middeldorp is more about thrombosis in women's issues. Would it help to have a male advocate, do you think, to discuss these things, or do you think it should come from us women?
It's a really good question. So I think I am in favor of an advocate from anywhere. And I think we actually are really lucky in the United States that we do have some really great male advocates for women's health and bleeding disorders. Peter Coides has done a ton of work in this area, Robert Sidonio. I think that we have a lot of men that are very vocal about these issues, which I think is great. So, I think the more people that are out there trying to educate and learn more and advocate for women, the better. But I have heard things, and even from my own patients where if I have a male fellow go in to see them, they don't feel as comfortable talking about their periods. And so I think, that's also something that just needs to be dealt with. But I think it's great if, when men advocate as well. The more people, the better, the more progress we can make.
Great. Yes, and I think this has started a different way of publishing as well, because I also saw recently that in RPTH there's been an article on the Einstein choice about heavy menstrual bleeding in women taking anticoagulant therapy and a comparison with the dose of rivaroxaban and aspirin. So I think not only in women with bleeding disorders, but also women with thrombosis who are on anticoagulant therapy, this is still meaningful and very important to discuss.
Absolutely. Yeah, no, I think there's a whole nother set of issues. I think we don't do a good job of asking people on anticoagulants about bleeding and women specifically. I think there's a whole other set of issues, I think, that also need to be addressed.
Great, thank you. Well, as we just mentioned, there's so much work to do still. I think it would be great if we get to the point where we have global advocates for the sexism in bleeding disorders, but in women with bleeding and thrombotic issues in general. So hopefully that's something that we can achieve in the next 2 to 5 years. Perhaps the digital world that we've all endeavored in since COVID will help us with that, or not. But then hopefully at ISTH conferences in the next 2 to 3 years, we can continue to advocate for this issue. Thank you so much for your great presentation and your work and giving us some more insight into your article, Sexism in Bleeding Disorders. We hope viewers will read your full detail of your paper on our site, rpth.isth.org. And Dr. Wyand, I hope you will publish again in RPTH. Thank you for watching, and keep an eye out for the next RPTH recap.
Thank you so much.